Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before taking a temperature with an electronic thermometer, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Before you begin, practice hand hygiene, identify the patient, and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Good morning, ma'am.
Morning.
My name is Ellie. I'll be your nurse assistant today.
Oh, good.
Good. And what is your name?
B. Contestable.
And Miss Contestable, what is your date of birth?
3/27/31.
Okay.
To prepare for an oral temperature, ask the person not to eat, drink, smoke, or chew gum for at least 15 to 20 minutes before the measurement, or as required by agency policy. To prepare to take a temperature at any temperature site with an electronic thermometer, plug the probe into the thermometer. Position the person. Use an upright position for an oral, axillary, or tympanic membrane temperature. Place the person in a side-lying or Sims position for a rectal temperature. If contact with blood, body fluids, secretions, or excretions is likely, put on gloves. Then insert the probe into a probe cover. Standard electronic thermometers have separate oral and rectal probes. The oral probe is blue and is also used for axillary temperatures. The probe for rectal temperatures is red. For an oral temperature, ask the person to open her mouth and raise her tongue. Place the covered probe at the base of the person's tongue and to one side, and ask her to lower her tongue and close her mouth. For a rectal temperature, put a small amount of lubricant on a tissue. Use it to lubricate the end of the covered probe. Now expose the anal area. Raise the upper buttock and insert the probe 1/2 inch into the rectum. Hold the probe in place. For an axillary temperature, help the person remove an arm from his gown, but don't expose him. Then dry the person's axilla with a towel. Next, place the covered probe in the center of the person's axilla. Put his arm over his chest and hold the probe in place. For a tympanic membrane temperature, ask the person to turn his head so that his ear is in front of you. Be sure the person has removed his hearing aid from the ear you will be using. Now pull up and back on his ear to straighten the ear canal and gently insert the covered probe. At any temperature site, start the thermometer once it's in place and according to manufacturer's instructions. Hold the probe in place until you hear a tone or see a flashing or steady light. Then read the temperature on the display. Then remove the probe and press the eject button to discard its cover. Return the probe to its holder. Remove gloves if worn and practice hand hygiene. On your notepad or assignment sheet, note the person's name, temperature, and temperature site. After taking an axillary temperature, help the person put his gown back on. After taking a rectal temperature, wipe the anal area with toilet tissue to remove lubricant. Dispose of the used toilet tissue. Then cover the person, remove and discard your gloves, and practice hand hygiene. After taking a temperature with an electronic thermometer, perform post-procedure care. For example, return the thermometer to the charging unit and practice hand hygiene. For detailed information, see the section on follow-up care, reporting, and recording in this program.